as the crow flies on the Vance Crow podcast.
Luke Mulch, welcome to the podcast.
Hey, what's up, Vance? How are you doing, man?
So you are my jiu-jitsu at my same gym. We are not anywhere close on the same levels. You are a brown belt. I am a white belt, but you are a good dude. You are a guy that can whip me easily, but instead what you do is you allow me to try and put you in a choke or to hold you down, and then you get out of it. So you improve by making yourself the most vulnerable. I have always respected that. I like rolling with you. You're a challenge, and I respect you. But in addition to that, you are a nurse, and you were one of the first people that I saw out there collecting masks and getting ready for coronavirus. And so I have been very interested to hear what you have seen, how it's gone, and just talk about what your perspective on coronavirus is.
Sure, man. Appreciate the kind jiu-jitsu words. I can touch on that real quick too about, taking it easy or whatever. I don't see that, man. I think you guys all come pretty hard, man. So it doesn't really benefit me to just go full throttle and use all 250 pounds of my body to just crush people all the time. So like when I roll with you, for instance, man, you are getting a lot better and you're improving. Don't sell yourself short, man. You guys, all of that gym are really, really badasses, and I look forward to getting back to it at some point. But back to the nurse thing, man, what's my perspective? Well, I guess first of all, I could paint a picture of kind of what my job is. So I know you had, that's the other person. I did listen to a podcast with Steve Ernst, who is also an ICU nurse and also does jiu-jitsu with us. I thought he was awesome, man. I listened to it at work, actually. So basically, man, we're going in and taking care of the sickest of sick patients, right? And the things that we provide in the ICU that other floors couldn't provide, like a regular medical surgical floor or a telemetry floor, would be we can offer a better ratio, nurse to patient ratio, number one. But what we really do is provide services like ventilators. I shouldn't say services. We provide ventilation with a ventilator, and then we also do things with medications that other floors can't do. We do things with what we call vasopressors, which are medication drips, and we titrate those basically to raise or lower blood pressure. So you have vasopressors to raise blood pressure, and then we actually have medications that lower blood pressure. And then we also sedate patients and put them on ventilators. So we're tinkering with several sedatives to try to get a patient to be relaxed and not remember anything about being on a ventilator. And then we're also dealing with their hemodynamics. Maybe their heart rate's too high, their blood pressure's too low. Those are kind of the things we encounter a lot of. So typically we have anywhere from 1 to 3 patients. So when I come in to work, a typical day would be I go get kind of my supplies that I'm going to need, stethoscope, and just other various things, scissors, XYZ. And then I'm going to get a overview of what's going on in the ICU. Who are our most critical patients? Is there a violent patient on the floor? Are we not letting family in for a particular patient? Things like that. And then...
Wait. I mean, you just threw something in there that, like, I almost started laughing. Like, you actually have to worry. Are there patients that might attack the people that are trying to give them medical care?
Oh, 100%. I came in just 2 weeks ago, actually, and typically I'm the nurse that they give these patients to. Though I will say at this particular hospital I'm working at now, it's not as bad. But oftentimes we'll have patients, it's very common for a patient to be restrained, first of all.
What?
Yeah, so So if you're ventilated, the chances of you being restrained are very high. That said, you're not going to really remember being restrained, okay? And what actually happens a lot of times is, which is actually good, a patient will, even when they're sedated, the instinct is to reach up to your breathing tube, right? Your breathing tube is connected to a ventilator, and then the ventilator is the machine that sustains your life. But when you wake up, because sedatives are tricky, man, it is a ball game of keeping somebody down to the point where you can wake them up and talk to them, but you don't want them too awake, but you also don't want them what we call snowed, right? Because what will happen is they wake up and their instinct is to pull their breathing tube out. And now all of a sudden, if your patient pulls their breathing tube out, they have sedatives running. You've probably heard of propofol from Michael Jackson. That's what he was getting to sleep. If you have that running, that suppresses your ability to breathe. And now all of a sudden, you just took out your lifeline. So alarms will go off, and you've got to like throw some other oxygen via like a face mask on before these people die. I mean, this is something that happens a lot. We call it self-extubation. So to counteract that, you tie somebody's wrist down. But to your point, you're talking about just a straight up violent patient. Absolutely. Somebody could be an alcoholic that's withdrawing, or perhaps they had a stroke that's kind of altering their mental state. And you have to tie not only their arms down, but their legs down. And then you have to have a nurse in there 24/7 to make sure they don't do anything stupid. And I've even got into several physical confrontations with patients. Probably the most recent one is a patient was standing on a bed. He was a younger guy. He had a full cardiac arrest, and he got resuscitated. And he went through this whole thing that I could tell you about. It's called hypothermic cooling, where we purposely essentially raise the or lower the body temperature of the patient for 24 hours, I want to say, and then slowly rewarm them up. So this guy went through this whole process. So physically, man, he was a young, strong kid. He was totally coordinated, but his mind, he did not know where he was at. And it got to the point he punched his mom in the room, and then he punched, or at minimum, because I didn't quite see it, the lights were off, swung and hit a nurse to where her face was
oh my God.
On the side. So I'm like, click the lights on. I hear this ruckus because security had actually just left because the dude freaked out already. And security's like, everything's fine. They got the kid back in the bed. Within 5 seconds, he's back up, flinging bombs at people. So this is where like my experience with jiu-jitsu comes in handy. But I grabbed that dude. I reached across. I almost like bear hugged him because he's standing on the bed. Reached across, grabbed his far side arm, and then switched arms and grabbed his wrist, and then went kind of underneath his legs, and almost like you're cradling a baby, and then elevated him, slammed him, and then pinned his wrist to his body. And then he is looking at me, bro, like completely flexed, like saliva coming out of his mouth, wanting to like tear my head off. And I'm like, get the restraints. And his mom's like, his wrists are bruised. I don't want the restraints on. And at that point, it's like, ma'am, I don't give a shit. We're restraining them. You know what I'm saying? So, yeah, we deal with violence. But I veered off course a little bit. But,
I mean, it's my fault. I'm the one that called it off there because I got to tell you that there's no part of my day that's going on right now where there's even the slightest chance that would happen, right? Because I am isolated.
Right.
I'm coronavirus lockdown. And I think about like you're going into work and you're dealing with that's the level of people that you could be around. What is going on right now with coronavirus?
So right now, man, so if you look at our ICU, right, it's 20 beds, okay? And essentially on like the south side of our ICU, there's a string of 10, and on the other, there's a hallway in the middle, and then there's 10 more beds. So we have one side of the hallway that's dedicated to the COVID patients or rule out COVID patients. And I would say, 3-4 weeks ago, it was like one or two. And then, I guess it would be about 3 weeks ago, it was, 5 or 6. And now it's just that whole side. So the last 2 weeks, it's pretty much just been that one side of the hallway with either confirmed or active cases of COVID, in which case, if they're in the ICU, they're in the ICU because they're either rapidly declining, meaning they can't oxygenate with just like a face mask or a nasal cannula, which we've actually been doing both. We've been putting nasal cannulas on, okay, and turning them to their max settings, and then throwing on a mask as well over the top of that, and then turning oxygen onto that too. That's not something I've ever seen before, man. And I think the reason behind that is because the other reason that these patients come to us is they're ventilated, meaning we have to manage this ventilator, okay? But most of the patients that are positive in the ICU are all on a ventilator. And unfortunately, the odds of them getting off that ventilator and surviving is very low. About 80 to 85% that decline to the point where they need a ventilator don't get off, and they end up dying. And I don't want to get into too many details about my actual hospital, but there has been a good handful of people that have died already from it. So, I mean, it's definitely it's definitely not a hoax, and I've worked too, Vance, like through a really bad flu season, and we don't have a whole hallway of patients lined up on ventilators just from the flu. You know what I mean? So that's kind of where we're at. But
so let me ask you, how, like, is it people that you would expect to be in the hospital? Is it overweight people that haven't taken care of their health, people that are older, or is it like you look around and it's just random, like a whole bunch of car accidents just happened?
That's a good question, man. So my brother actually asked me that same question. So I just went through and jotted the age distribution. Nobody in their 20s, 2 in their 30s that don't really have a documented health history. And then it's just kind of like scattered throughout. I think we had one 92, had a few in their 50s, 40s, 60s, all over the board, man. But if you're going to talk about, if I'm just visually looking at that person and look like, are they healthy or not healthy? I would say overall, I'm not getting like marathon runners in there. That's not to say that can't happen. I just haven't seen it. You know what I mean? I can only go off of what I've seen. But so, man,
I mean, just cutting straight to it. You and I both know a lot of guys that are working right now. They're driving trucks and they are delivering stuff. And then a lot of guys that aren't working. And, you're a healthcare professional that will be impacted if the disease spreads more. Do you want those guys to be able to be out there working because it doesn't look like they get sick enough to get into the hospital? Or does them out there participating in the economy put you at greater risk and more than you should be willing to have to endure?
I would say this. If going back to work and kind of opening everything up without, any sort of precautions, and there was, a large spike of infections and people kept coming in, we would get stretched to the limit, but I think we could deal with it. Obviously, I would be probably exposed to more cases of COVID. I can tell you right now, my hospital is already preparing for like the worst possible scenarios to where I would essentially, and all the other ICU nurses would act as kind of like almost like a manager for nurses that aren't traditionally ICU nurses. So I would have more or less like 4 nurses under me. And then I would be responsible for managing the ventilators and just like taking care of any problem that might arise. That's kind of how it was framed to me. We haven't went over the X's and O's in that, but that's kind of
and that's with the expectation that there are so many healthcare workers that have been infected by it because they've had to care for people that have it, that there could be a drastic reduction in the number of nurses that are available.
Say that one more time.
So you're saying that that you have been trained based on what happens if a whole bunch of healthcare workers get coronavirus because they've been exposed at so much higher of a rate than the normal people that would be running the hospital would get sick. And so you'd have less people to be able to manage. So you'd have to bring in new nurses from another place or maybe that aren't normally doing this type of work.
So that's a good question. Sorry, I didn't really clarify that. So we have right now, other areas of our hospital are actually low on their census. So, for example, we have a whole floor that takes, elective surgery type patients. And then overall, I would say people are trying to stay away from the hospital as much as possible. So if you look on every given day on a hospital, there'll be a surgery schedule and there'll be, I don't even know, 30, 40 patients on that surgery schedule. Those patients aren't there anymore. So we have nurses. We just don't have ICU nurses. A lot of our nurses right now are being furloughed, actually. We've had, and I don't know if I want to get into this, but we've had administrators let go too because I assume we're in the financial trouble. I mean, I don't look at the books, but I mean, we've let several administrators go. We're furloughing nurses. The next thing to go is probably they're going to let some nurses go, you know? I don't know. It's kind of weird, man. It's like in certain areas of the hospital, it's a ghost town. But if you go to the emergency room in the ICU, it's a completely different story.
Well, so a family member of mine, I'm not sure she'd want me to talk about it, was going through cancer treatment. And I was like, oh, my God, you know, coronavirus, you're going to have a weakened immune system. Maybe you should talk with your doctor about not doing it. And she was like, no, I've already gone partway through this radiation. They say they can keep it clean. We're separate. We're doing everything we can. I'm going to go forward with it. And the whole time I was super nervous, but now she's out on the other side. And I'm really glad that's just
awesome,
done
man.
with, you know. But what about all these people that have delayed these types of treatments? Are those kinds of things happening?
Oh, 100%. I mean, 100%. I think they're kind of viewing things in a different way. Like if you really don't need something right away, we're going to hold off, you know. So overall surgeries are down. Like I told you, like our open heart surgery area that we reserved and half of that ICU. Did I touch on that? So the area that's now the coronavirus patients usually are reserved for people that had a coronary artery bypass graft, right? A bypass surgery. So we don't have any of those now. There are very few, unless those patients are requiring like an immediate type surgery, we're not touching them because the risk of infection is just too high. So yeah, definitely less surgeries overall, and it's definitely impacting those nurses as well. They're like I said, not able to get a lot of work, which is kind of crazy, man.
What is going on with people that are having heart attacks? Because it's not like people have changed their health such that they don't have to go to the hospital and that kind of stuff.
So for sure. So if you do have a heart attack, there's usually two different ways. The first line of treatment, if you come in with an acute heart attack, you're going to get taken to the you're going to have an EKG. It's going to say, hey, this dude's got a infarction somewhere in his heart, meaning there is a vessel block. So what they would do is take you to the cardiac cath lab. What they do is stick a catheter either in your radial artery or into your groin and thread that through your vasculature up into your heart. And then they take a look around with a little camera on the end of this catheter, and then they stent. You've heard of a cardiac stent. They put a little stent and open up that artery. Now, what happens, though, is a lot of times these people have such bad heart disease, you can't do anything to fix it. That's when you would have to say, okay, I've got to open up their chest and do a coronary artery bypass graft. So if that was something that was 100% emergently needed, I'm sure we would probably do it, but that doesn't happen very frequently. Typically, if someone comes in with a heart attack, they will still take them to the cardiac cath lab. That's considered kind of like an emergency. That said, we've already discussed talking about alternative treatments to the cardiac cath lab, which would be giving these patients, instead of taking them to the cath lab and deploying the stent and opening up the artery, we would give them a thrombolytic, which essentially is a medication that will just bust up that clot. I mean, that's the ideal outcome, bust up that clot, and then blood flow is restored. That works pretty well with strokes. I don't know how well it works with heart attacks, because you've got to assume, for the most part, a lot of times those arteries are just clogged up with plaque, and then just over time slowly close up, and then you don't get blood flow. So a lot of these patients, that need, say, an open heart surgery have experienced symptoms like shortness of breath for several months. It's not necessarily that they're coming in with, elephant standing on my chest, crushing chest pain and need surgery right away. They're just going to have to sit around and, be short of breath, more or less.
So,
go
ahead.
I was going to talk about kind of like what's different about dealing with these coronavirus patients instead of, just kind of your typical day. But
yeah, tell me about that.
Well, so like, and I know you talked about me like collecting all those masks and whatever. So kind of crazy, man. We were like, it's weird. And I'm not saying it's like where I work, because this was happening everywhere, but just the very like beginning, before like maybe we had one or two of these COVID patients, man. We're already like, rationing like these N95 respirators. So there's most people, I don't know if most people know this. When I say ventilator, I'm talking about a machine that ventilates you with the breathing tube, but the respirator is just more or less a face mask. And you can see, sometimes you'll see people wear these at the store. They have a band that goes back behind their neck, and then one around the top of back of their head rather. And then they have a little thing you can squeeze at the bridge of your nose, and the idea is you create this seal where, nothing can come in and infect you through the air. But so like in my nursing career, bro, I've always been taught, hey, you get one mask every time you go in that room. Before you leave that room, there's a way you dispose of, take off your gown and dispose of the mask. There's certain protocols you follow, man. This is a one-time use thing. So now, all of a sudden they're saying, hey, you get one N95, you're putting it in a brown bag, you're keeping it in your locker, and you're breaking that bad boy back out. And we're all like, there was obviously some outrage from nurses, like this is totally, not protecting us because the bacteria is just going to live on the mask and move all over the place, right?
It's a virus, right?
Man, what's that?
It's a virus, not bacteria, right?
Oh, I'm sorry, the virus rather. Yeah, and then we have other things too. So like, I think part of the problem is, and I don't know, but we didn't use a lot of N95. We use these capper air shield or face shields that sit in front of your face, and then they kind of bind to your neck, and then you kind of plug them into a battery pack, and they continuously produce like airflow inside the actual kind of helmet you're wearing with this face shield. And those face shields, you know, you're supposed to throw those away like, I guess it's like once every shift unless it gets soiled. So we're keeping these things, bro. Like I've still got one from like 3 weeks ago.
Now, is it that they are rationing them so they have them in the future, or is it that they don't have enough right now and that the storage room is almost empty?
So that's a good question. So the N95s, they definitely, I think they definitely have some that they're reserving. Those face shields, as far as I understand, man, like we don't really have any. So we're seeing a lot more nurses ditch those because their integrity has kind of been compromised, and we're sticking to the face shields, and then, or not face shields, but N95s rather. And then what we're doing is having them go get sterilized. And I don't even know the process for sterilizing them, but then they come back in another paper bag with our names on them. And then that's our sterilized mask.
I mean, it's UV light is probably the best thing you got. I mean, I wonder, it's just putting them out in sunlight.
What they're doing, man. And I've read like articles about that, and I've heard they kind of like damage their integrity, like filtration.
The sun,
by like 2/3.
People don't understand. So when I lived in Africa, you would wash your dishes with whatever you could. I had like a lye soap, but even if you didn't, you would set the because you're washing it oftentimes in water that you haven't like boiled. But the sunlight is so strong that you can even leave water on the edges of the plate and put it out in the sun, and the sun will clean all the water out, so you don't have to worry about contaminating that way. So like the sun clears all kinds of bacteria, all kinds of stuff out. But people also don't realize that, like, if you're talking about a fabric like you are the mask, which is just wires that are just wound over top of each other with like some kind of polymer in between them, that wears that stuff down in the same way that it wears the disease on them.
Right. Yeah, man, I don't know. You know, as far as what I can see on the mask, it looks okay, but obviously the studies are saying, hey, this isn't entirely.
How many days are you wearing a mask for?
So it's hard to say because like some weeks, like last week, I didn't get like COVID patients. So I was actually only wearing a regular surgical mask and then protective goggles. That's kind of our MO if we don't have COVID patients. When we're just like in the common area, we always have to have a face mask, which is great. Initially, we weren't even doing that, which, you know, it's not a great approach to try to not spread infection. I mean, we pretty much, I'll say everybody I work with has done a great job, man. And we are definitely on board with preventing infection. But just thinking about like before it really popped off, if you think about the fact that, hey, you might come in contact with a COVID patient and now you as the nurse are asymptomatic and you're not wearing a mask, you're going to go take care of the next patient without a mask and potentially get them sick. I mean, that's a reality. That's why you see like these outbreaks in nursing homes or prisons or these, you know, very dense areas that aren't taking the proper precautions, man. They all get sick. Not to mention, like in a nursing home, they're already all, you know, compromised for the most part.
So I worked on a cruise ship for a while, a small one, and it was amazing how a disease could spread around a ship, just like lightning. And you never see it when you're living in a town, right? Because you just don't see that like a disease spread through a place. So I think one of the great fears that people have is that there'll be a series of things, a bunch of nursing homes or a couple of offices get it, and then are now all need to come into the hospital. What do you think of that? Is that something we should be afraid of, or do you think like nah, it's not going to come in at the tide didn't come in as much as we thought that it would come in.
I hope there's no tide, bro. Like I'm ready for it, but yeah, I mean, if there's something particularly like locally, like all of a sudden, like a whole nursing home has an outbreak, I mean, they're definitely going to be flooding my hospital, I would say. You know what I mean? That's a reality. And another thing you touched on is like, you know, so like I don't think, you know, you've heard these people like that don't think this is real. And the reason they don't think this is real is because they're not living in areas like New York City, where they're loading up trucks full of dead bodies, man. They're living in central Illinois. The outbreak is not as prominent here, man. So when people like try to say this is the government trying to, you know, take control of us, this and that, bro, I just try to look at this stuff logically as possible. You know what I mean? An outbreak happened in China. A bunch of freaking people died, okay? It came to the United States. We're taking steps to control the infection. A shit ton of people died, and the economy is wrecked. Now, when you look at it like that, man, you can still sit here and tell me with a straight face that this is some government ploy. I mean, you're insane, man. And from my perspective,
I think that you could make the case that people are worried about, that we thought it was going to be worse than it was, and it doesn't seem that bad. And like,
I agree with that, and I agree with that.
Okay.
And I agree with that, but it's so weird, man, because you get all this information thrown at you, and it's hard to kind of piece through. It's kind of a weird virus. I saw one yesterday in California where it said like a large amount of their population has already been exposed because they had antibiotics to the coronavirus. Did you see that one?
Yeah.
Yeah, man. So I don't even know what to make of that. It's kind of crazy. I mean, I hope they're saying, hey, we can go back to work and start living a normal life, man. There's nothing more I want to do than like go back and start doing jiu-jitsu, bro. And I hope it is not as bad. The death projections have went down drastically from what I initially saw too, man. They were saying, I don't even know, 500,000 deaths in the United States. And then I just looked not too long ago and it's like, which it's still high. It's like 160, 170.
What sort of precautions are you taking right now? Because you're working at a hospital. You come home.
Right. So, man, I work with some awesome people, man. These nurses, dude, I'm blown away. Like how much shit they go through and just keep showing up to work, man. Because essentially what happened, man, this one guy, so I'm living in my basement right now, but this guy I work with, Josh, he moved into a house here in O'Fallon. Like somebody just had some rental house and they said, hey, bro, you can live in it. And he asked me to come live in it. I've got a wife and 2 kids, you know, and I'm like, damn, man, I didn't want to bring that virus home because I'm literally, man, staring this thing in the face, right? And I'm covering it. When I get home from work, I strip down in the garage and go straight to the shower. And then if I come upstairs or go in like the common area, I'm wearing a mask, man. But back to Josh, he told me to move in, and that kind of like made me think, man, maybe I really got to start like worrying about not, getting my family sick. And even though like the risk is really low, man, being that you're younger and fairly healthy, I just think about the fact that I've taken care of people my own age, right, that have a way shorter health history than me. I mentioned a couple that don't look healthy, but on the books, they didn't have any health history. So I thought about that, man, and I just kind of did my own thing. But I think that, dude, because the odds of me getting sick, I mean, there's definitely a potential. I could be an unlucky one that could get sick and die. But I would hate to think that, I got like either my kids
or my wife sick. Is that still a possibility? Sure, man. But I'm going to do everything I can in the meantime to make sure that they don't get sick. So I moved down to my basement, bro, and I got a microwave and like a Foreman grilling machine and a fridge down here. And it gets pretty lonely down here, I'm not going to lie, but I try to stay outside most of the time. I lift a lot of weights in the garage and stuff if I'm not working. So it's not too bad, man. I got a bedroom down here, so I'm not complaining. I know.
And as you look out on the horizon, would you do that for another 2 months?
Well, and that's the thing I talked about, is like how sustainable is this, man? Like how long can I do this for? And I probably, man, if more patients kept coming in and it doesn't die down, I could do it for 2 more months. That's not a problem. At the end of the day, I would do that, man. I just want to make sure, you know, what I would love is to be able to say, hey, you have antibodies to this virus, you know, and then I could not worry so much about it. But for the time being, man, I'm cool where I'm at. And I'm not the only one doing this, man. Like I've got a nurse I work with. Her name's Sarah. She's awesome, bro. These people, man, can stare like in the face of death and like have a heart rate of like 50, bro, and just handle it, man. And when there's a patient crashing, bro, there are so many precise steps you got to take and just be on point to do your job well. And just like seeing someone die in front of your eyes and bring them back to life is awesome, man. These people are really good at it. I include myself in that. But she lives, anyways, back to Sarah. She lives out, what do you call it? In a camper, bro, out in her front yard. And she's got her husband inside. And a lot of these people are better off than me. Like, you know, I'm fairly healthy. My wife's fairly healthy, but like that's not everybody's situation. A lot of people have very, you know, people that manage and deal with chronic illnesses.
Yeah, nurses are people too. They have illnesses
nurses definitely have illnesses. I mean, we're stressed to the gills. Like it's really common to see an unhealthy nurse, bro. I mean, I'm talking physical health. I'm talking mental health. That is a real reality, particularly in the ICU that we deal with. They say like the ICU nurses' PTSD rates are like as high as a veteran of, you know, like the wars in the Middle East.
Well,
bro.
when I would come home from being a deckhand on the ship or being out in the Peace Corps, I would hang out with nurses because they partied, right? So like, you know, they are blowing off steam. If they've just gotten off like 4 days of working 12-hour nights and then they go out and party, like, and that's not because they're healthy.
There's a reason they do that, man. You know, with any stressful job, you want to take yourself out of that stress, bro. That's why they're drinking. That's why I know a lot of nurses that got into drugs and crap like that. A lot of nurses that are on anti-anxiety medicines.
So let me ask you this, man. Like, you're this big old hard dude. Like, if you want, you can crack heads, and you're a nurse, which people typically think of as like white dress and, you know, I don't know, cute. And but I said it to Steve, I'll say it to you. Like, I would want you to be one of my nurses. What the hell? Why did you decide to be a nurse?
Oh, that's such a good question, bro. Man, I can tell you the story if you want to hear it.
Yeah.
I've done a lot of different things, man, but really like in my 20s, I primarily was like dealing poker and this and that. And I was getting to the point, like anything you do for a while, I was just kind of going through the motions. But what inspired me was my wife was she was having our firstborn kid, Lydia, who's now 8 years old, right?
and we went to Memorial Hospital in Belleville, man, and she had it in her head. She watched a documentary about natural birth. Like, she's going to go, no anesthesia, bro, and just push this baby out. Okay. And dude, I was there, and I remember I clocked it. We were at the hospital for 52 hours.
Oh.
And I remember, because that's like my basketball number in high school. It's like, I'm going to remember this. It's 52, right? So, anyways, bro, I remember being in there, and it was like the night before. It was early in the morning, I want to say, like 1, 2 in the morning, before the morning she delivered. Okay. And they actually delivered Lydia with it's like a suction cup. And by the way, at this time, I have zero medical knowledge, right? I know nothing. But they essentially like suction cup the baby's head to pull it out, right? And they're like, hey, we give you 3 tries. If we don't get it out on the 3rd try, we go do a C-section and just cup the baby out. I'm like, okay. So luckily the 3rd time they got it out. I was like, oh, thank God, 52 hours. And now we're on the 3rd time. Trying to suction cup this baby. I had the biggest wave of euphoria after I saw that baby take a breath.
Oh, man. You know that my wife is pregnant, so you're like describing a nightmare horror show for me. Thank you for this.
Oh, bro. So hers will be better. But let me backtrack, though. So it's like 1, 2 in the morning, man. And first of all, the whole time, man, the nurses there crushed it, dude. I was just like blown away, like essentially about situations that I perceived as being extremely stressful, right? And they were just kind of able to handle it with grace, dude. So, but it was like 1, 2 in the morning, man. And I guess they like screw like a little thing into the baby's skull to monitor the heart. And my wife is at the point now, bro, you got to imagine. And she had this done like the night before. Okay. And she had a anesthesiologist or a nurse anesthetist come in and do an epidural, which is where they thread this little catheter in the spinal column and give you this medication to basically numb everything from the waist down, right? And that anesthesiologist, bro, he looked like Igor, man, like just like some old crusty dude. He's back there, he's fixing this thing in, and he's like, oh, I got some of the medicine like in somewhere where it shouldn't be, and he's like, you're gonna have a very bad headache. He warned her essentially, but she got a little relief for the time being, like. Dude, if you saw my wife, bro, at this point, she had looked like she had run like 3 marathons and like had nothing left. I was just like, oh my God, how is she even alive? I thought I was looking at someone that was about to die, bro. So, anyways, she's going to kill me for telling this story. But anyways, she's sitting there, and it's that morning, and now all of a sudden, bro, she's got a headache, like the most painful headache you could ever think of. And I'm like, what the hell is going on? At the same time, that heart monitor stops. Okay. And then this stuff called meconium comes out of the vaginal canal, which is essentially like stool from the baby. Now, I don't know anything about this. What's going on? I thought I was looking at my baby and it was liquefied. I don't know anything. And those 2 nurses, dude, just dealt with it. And like, I'm sitting here like fumbling, freaking out, sweating bullets. And it was just no big deal. And like, after that, I thought to myself, man, those are some badasses right there, bro. So that's kind of like got me thinking about it. And then I finally took the leap. I remember I was like,
wait, that's a huge jump. You're saying you watch all this happen. They are the cool under pressure. They're in an intense situation. It's one thing to respect those people, but to decide that you want to go become one of them, that's different.
Yeah, it was. So, I mean, so that was kind of the thing that set that idea off. But like, dude, you just have those moments in life, and I don't know how many I've had, but dude, I was just sitting there like on my computer I don't even remember what I was doing. I think I was just looking for jobs, man, because I was just tired of dealing poker. And actually, the place I was dealing poker at, River City Casino, like our business was down, and I could kind of see the writing on the wall that it wasn't going to be around much longer. The poker room itself, which it actually did shut down like a year after I quit. But anyways, I was looking at jobs is what I kind of remember. I haven't thought about this for a long time. I was looking at jobs, like best jobs you could have, right? It was like top 100 best jobs you can have. It's like on Yahoo News or something stupid. And number 2 is like CRNA, which is basically a nurse that deals with anesthesia, right? And you make good money and this and that. And so that was kind of like my ultimate goal. I was like, that'd be so awesome. And then it kind of like, man, maybe I should just do this nursing thing. So I looked up the other kind of thing that really swayed me into it is they have 1-year nursing programs to get a bachelor's. If you already have a bachelor's degree, doesn't matter what your degree is in, you can get into kind of these fast track programs. So I applied for that. And fortunately, because I'm a male, it's pretty easy to get into nursing. So I got accepted, man. I just went for it, bro. But
and is it what you thought it would be? Did you, when you imagined being a nurse, did you sign up for coronavirus pandemic?
No, man, I didn't. But if you're gonna say, did I think it? I didn't know. I didn't know what to expect. I'm just kind of like an oddball, bro. I'm like, I'm not someone that. Well, if you would have asked me when I was younger if I was going to be a nurse, I would say no. But I would say there's no way. You know what I'm saying? But so I'm kind of an outlier in that respect. But dude, what you expect in your first year of nursing as a nurse is, particularly me, a lot of people get into nursing and have like what you would call a nurse tech experience or like a nurse assistant. So you at least a minimum have some level of knowledge about, hey, this person needs more oxygen, or I know how to roll and maneuver patients in a bed. I didn't have any of that, bro. And I got my first job in an ICU. And let me tell you, man, I got like 5-6 weeks orientation. They pulled me off early because we didn't have enough nurses. And you are scared to death, bro. It is, for one, probably your first year as an ICU nurse, I remember going in the bathroom, bro, and just like having like little mini panic attacks before work. That freaking scared me, man. But like, I remember going in there and like, I remember the first time I went to like a overview with the night nurses I was going to be working with. And I was like, these people are the craziest, like, I've ever met. Like how they talk about things, like it's insane. Like, you know what I mean? Like they talk about just like being able to talk about death and, oh man, did you see this and that? And I'm like, man, this stuff, I'm sitting here wide-eyed like this stuff's nuts, bro. I'm just trying to keep these people alive.
I mean, and like, I think most people have never seen an animal get killed, let alone watch a human being die. Or like struggle and have as much trauma as what you see in an ICU.
Oh yeah, for sure. I mean, and I mean, I've pressed buttons on pumps and stopped them, bro. And then within seconds, the patient dies. Like that's crazy too. You know what I'm saying? Like everything. A lot of times it's kind of interesting. We'll get families that say, hey, I'm going to leave it to God's will. If they're in the ICU and they've got all these medications going and this ventilator, it ceases. A lot of times it's not in God's will, okay? That's crazy. What unfortunately happens is a lot of times these patients, at least from how I perceive it, is they're being tortured, man, just to keep them alive, just to keep heart going. It's actually really sad sometimes. And that's another thing, a lot of, and I'm trying not to get all
my wife told me don't get too dark and dreary, man. But that's a lot of times like what we have to put up with when you talk about like, like you never want to do things that you're like morally conflicted with. Just because they say in Cool Hand Luke, man, just because it's your job doesn't make it right. So I feel like I do that a lot, unfortunately. I'm veering off track from.
No, this is amazing. I mean, I think it applies to every person.
Yeah, man, it's crazy. So if I could give like anybody advice, bro, out there about like end of life, right? Because I see a lot of end of life, and everybody that's alive right now is going to die. And what happens is when someone declines and they're in, say, an ICU, is that person in that bed is no longer going to be able to make decisions for themselves, right? Because they either have a breathing tube down or they had a stroke and they can't process things normally. So, somebody's going to have to make that decision, in terms of their treatment, how to go forward. And oftentimes no one's been designated. So all of a sudden it becomes a fight between family members. Hey, I don't want to put in a feeding tube or do a tracheostomy. Well, I do. What doctors are going to do is they're never going to, if somebody wants a tracheostomy, like the wife, but all the kids don't want a tracheostomy is cutting a hole right here. And now all of a sudden you have a trach inserted, and that's how you're going to breathe potentially for the rest of your life. It's not always the case. But a lot of these people are at the end of their life anyways, bro. And at the end of your life, do you want a feeding tube? And do you want something in your neck when you don't even know, bro? You don't even know your name, okay? You don't know where you're at. Okay? You don't know what year it is. You can't eat anymore because everything you eat goes down to your lungs. What are we trying to accomplish with sustaining life? The person in that bed doesn't want all this shit done. And unfortunately, they're no longer able to make those decisions. It's crazy, bro. So what I would recommend anybody, man, is to have a power of attorney that is somebody that's not even in your family. That's someone that knows medicine, man, and can kind of interpret information from a doctor or a nurse and make a good decision. But that's just my 2 cents on that.
No, I'm 100% with you on that. And I think people, so, when you start a family and you start thinking about like, hey, I'm going to have a responsibility here. How am I going to want things to work if I can no longer earn or provide for my family? Like, how do I want all this to work out? And all of a sudden you start answering questions and saying, who's going to be the person to make that call when I'm not around? And I can't believe it because I'm the middle child of 7, but I would absolutely never have imagined when I was growing up that I would want my older brother and my younger sister to be sitting there giving my wife advice. But my older brother knows like me really deeply and really knows what's up with me. And my little sister Alicia is a nurse, and she is realistic on like what the cost of doing CPR is, like what it looks like if you've cracked open ribs. And I want her to be able to say that to my wife. Like those are the two poles but I want my wife to make the decisions.
Right. Yeah, man. Once you get to CPR, that's
that is a universal jiu-jitsu at BJJ Lifestyle Academy where we train. There are a bunch of nurses, almost all of you ICU, and everybody has rib cracking stories from CPR. It's a regular thing that they talk about.
They say I have I shouldn't say they say it, but I had a doctor. We have a device. It's called an EMA, and you can attach it to the end of the endotracheal tube, and it reads. And then you attach past that. You attach the bag that ventilates the patient. That's what you would do before you hook them up to the machine, or if they needed like a little extra pump of oxygen, but it reads the CO2 level. And the better your chest compressions, the higher that number will go. And they say a good CPR, you get like around 20. I was hitting 42. And the doctor's like, no way, this patient has to be alive if his CO2 level's that high. It's like, stop compressions. Sure enough, no pulse. He comes up to me afterwards and he's like, I just want to say, those are the best chest compressions I've ever seen. I was like, thanks, doc.
Wow.
But,
what is it?
Yeah,
I think people have a skewed perspective because they've watched on TV, like, pull out all the stops to make it to save me. And it's like, what they don't show is that it's not pretty.
Ugly, bro. You're going to get your ribs crack. I mean, look, I've seen some really quick, good outcomes, usually like a quick defibrillation or defib where you're only like doing CPR for like 30 seconds. Those are best case scenarios. If you do have CPR done, man, and it's something we can fix, you can have a good outcome. The people that do the best are the ones that get CPR right when they arrest, though, you know, so we call it like a witnessed arrest. If you've been down for like 10 minutes and now all of a sudden we get your pulse back, your brain is never going to be the same, more than likely. So CPR's got its place. Where I don't think it has its place is someone that's 93 years old and can't even eat food anymore. You know what I'm saying? It's kind of crazy how we approach that sometimes.
So I'm really grateful that you were willing to come on and share like what is going on with coronavirus, because as a nurse, somebody that has been in the hospital, has seen it. To me, it's a big thing to hear, you know, exactly from you. And but before we go, I'm wondering right now, I was just trying to look up the date. What is today's date? It is April 22nd. It's Wednesday.
Right.
What do you think the world will look like 2 weeks from today?
Probably about the same, to be honest with you.
Will you be living in your basement?
Oh man, I hope not, bro. It is a little boring down here. That said, though, I will say that ever since I can't do jiu-jitsu, I have been doing stuff around the house, bro. Power washing, landscaping, all sorts of stuff, man. It's amazing how much time I have when like my hobby doesn't like encompass like every waking moment and thought. You know what I mean? So that part's kind of, in a way, it's kind of cool because I can get some stuff done. But
it's great to have a balance, like, right? Like there are a lot of downsides to this thing, but it's good to say, all right, what do I value? Why do I value it? Like, and I tell you what, like the camaraderie is what I miss. Like the whole bunch of stuff that got cut out for me that I don't really care about. But Saturday open mats at the jiu-jitsu where you don't know who's showing up, but you're just going to roll. You get a lesson in with coach and you're like, my whole week is better because
there's
of that.
Nothing better. Oh God, I feel so much better after I do that, man. I miss that stuff so much. And I hope it gets back to normal soon, man. I feel for coach. I know he's wanting to start it back up, and I do not blame him, bro, because I'm right there with him. I get the best release, man. It is like jiu-jitsu is almost spiritual for me, like a good roll. Like I feel like $1 million, man.
So I have a friend named Dave, and Dave does training of special forces. He teaches the martial arts. So like if you wanted to know who knows how to do combative arts, Dave is your guy. And that's how we found Coach. It turns out, I don't know if you know about it, Coach, but I get to hear all these background things. And so Mike Rethmeyer at BJJ Lifestyle Academy is an old school G, is what he said. He's from the old country, now comes to the United States and knows the secret magic like way to maneuver your body to dominate other people. And on top of that, he's a mountain of a man. And so you've taken this guy and you've pulled him out of doing the one thing, his art, which is the crushing of other human beings. And I can't wait to get back there.
I'll tell you, like, and you're right, man. And I know it's hard on him, but I know he had those hip surgeries, so I know he kind of knows already how to live, like, and all those hip issues he's had. He knows how to live through not doing jiu-jitsu. And I kind of dealt with the same thing, man. I kind of have like this clotting disorder. I've had a few blood clots and things. And then I tore my Achilles too. So I understand what it's like not to do jiu-jitsu, but at the same time, I've had periods of time where I wasn't able to. It sucks, but hopefully we just gotta hope for the best, man. Hopefully be back doing it. I mean, I don't really see a future in my life, bro, where I'm not doing jiu-jitsu. I mean, already I'm essentially non-compliant with taking blood thinners just so I can go do jiu-jitsu. Like, I'm essentially already putting my life at risk to do something I love. And I don't know if it's the smartest thing, bro, but that's how I roll, man.
I mean, I think that's maybe like this silver lining is everybody should be looking at the things they were doing in life pre-coronavirus and saying all the things that you don't feel are like actually connected to who you are. The things that like you ache, like I can hear how you ache for jiu-jitsu, right? But all the other stuff that you were doing that you did out of obligation or because you thought you were supposed to or you thought you were having fun, just all that.
Doesn't matter.
Get rid of that shit,
bro. Doesn't matter. That's what I want to get back to. I don't want to sit here and watch the news in my basement all day. Like, it's toxic, bro. To me, like I just want to get back. Like, I do my best, bro, when I stay busy. I go to work, you know, I'm lifting weights. I do jiu-jitsu. I make some food. I go to bed, and I just repeat that over and over and over and over, man. And like my well-being and my mentality is elevated to, you know, I kind of tripped up over that. But
well, I mean, I'm with you, man. Like I took coronavirus as like a weekend getaway or something where I don't have to get up on the same time and I can stay up late. And it has taken me a long time to be like, hey, the reason you were sane and productive before coronavirus was because you were getting sleep, you were exercising, you were, you know, doing these things. You had a pattern. And now I was treating my days without a pattern. Now I have one and I'm sticking to it. Bang, 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 get things done in the day because it's that productivity, that progress forward that makes me feel like good to be alive.
Right. 100%, bro. 100%.
Well, man, I love this conversation. Thank you so much for giving up part of your time off from work. I hope you stay safe. And anytime something changes with what's going on with you, let me know and we'll hop on and record something else.
Cool, man. Hey, can I give a shout out?
Sure, of course.
Okay. Shout out to all my boys at BJJ Lifestyle Academy. Love y'all. I know you want it. I know you want your names called by name. I'm gonna throw a few out. Tony Bird, Morgan Freed, who else? Gerard, Lance.
I've seen Lance doing a whole bunch of stuff on Instagram.
Calderon. Oh, for real. All you guys, I know I'm missing you. Oh, Bart, aka House,
Bart, the builder,
Sheriff
yeah.
Bart. Man.
All right, your time is up.
Okay. I love you guys. All right.
Hey, all right. Thanks, man. I appreciate it.
You, bro.
We'll see you later.